I've been given the tools to carry on doing this myself, and the prize or the reward for successful therapy or rehabilitation is, getting my life back to how it was.
This came about as a really opportune moment when I was meeting with some colleagues from Active Sussex, and we talked about that real shared endeavour to want to do more for patients, particularly in the acute and the subacute setting. So these patients we know are really at risk of deconditioning whilst they're here with us. And that's because we're trying to increase that 24-hour picture for patients, but we still have those moments when we can't keep patients as active as they would be at home. What we formed was an opportunity for us to really work together in harmony and looking at how we brought in non-NHS workforce into an NHS environment to see if we could really maximise that opportunity for activity and really keep them as conditioned as possible during their inpatient stay.
So we have 3 members of staff that come in and work with the patients. So depending on where they are in their stroke recovery, it depends on how much help we need to give those individuals. But it's been really good to see sort of individuals going through their recovery and needing our help less. And we're seeing patients now coming into the community and doing some of our exercise sessions, and just seeing that process that they go through and the progress that they make from coming into the stroke unit to then coming out into the community is fantastic.
I do follow-up calls after people go, just to see how they're getting on, if they'll be able to access the groups. And usually what we find is that those who seemed most resistant to going to therapy to begin with, when they're given that safe space to work in with other people who've had similar experiences, it makes a world of difference for them. I think having someone else based in that community setting as well kind of gives you a better idea of what's going to happen after they leave, so it even reinforces your clinical understanding whilst you're here. So it's one thing, understanding how many sets of stairs someone can do, but as soon as someone gets home and they're faced with new challenges that we in an inpatient setting aren't usually faced with, it's nice to have that continuation, and let's develop practices even more here.
I think one of the key things that we've really enjoyed about this project is working both in partnership with Active Sussex and 2020 Health to deliver this project. It's been a great way to kind of test out all of those strengths of the different partners and how they come together to help us deliver something that's much better for patients. And I think what this project will do is really offer our system here in Sussex a really great opportunity from which to build in how we work much better with our community partners.